He graduated in USA, and he all his study was in USA, and his practice is in Surrey. One thing that's famous about him, well, no, sometimes people have difficulty conversing, then they go to him, and he will explain very well to the diabetic patients. You can see in everybody's presentation, all the presenters after such a long time, that it very good way, very nice way to explain things. So Dr. Mohan, please come, and if you want to get your eyes tested, and if you want to treat your eyes when you are diabetic, it's a beneficial to you, to your family. You can talk to him, and how could you remain active in your life, and for yourself and for others. So so in our community there is a lot of confusion. So I want to tell you all, MSP covers your eye examination if you are diabetic. If somebody is charging you, then in that profession, and you ask questions, and otherwise move to someone else. So Dr. Moon, thank you. Thank you, Dr. Chima. Hello, Sasrikal, welcome. As Dr. Chima mentioned, my practice is in Surrey. We will talk about today how diabetes affect your eyesight. We will talk about that. All right. Blood, high blood sugar affects your eyesight. There are studies, research. We will talk about that, how it affects your eyesight. But there are other things that it does beside the eyesight or affecting eyes. How often you should check your eyesight? So there are four main things that we will talk about, that how the diabetes affect those four things. So the the green portion you can see the front portion, and then the back of the eye you can see. So the blood vessels we can see very clearly. There's the site where sugar make problems. If you see the picture on the right hand side, there are two or three things. You can see those red spots. There is a bleeding, so the blood vessels burst on that spots. So first of all, how sugar affects, we call it white, we call it cataract. So most of the changes, when the eyesight goes down, then we, it could happen all of the sudden. It's not that it will gradually happen over the time, but it could all happen in 6 months. All of the sudden the eyesight is gone. So we can do the surgery for that, and it correct it, and it's covered in BC. So our ophthalmologist, they will help you with this.
And next thing is, a lot of people are asking, it's talking about there are some things that can be corrected, and then the cataracts, there are no medications, there's nothing, no technology available that can be corrected. There's so many other things that can harm you and create problems for you that you need surgeries for. Contact lenses people talk about, and that can also harm you. What is one thing is for sure, they should check it when doctors are checking it. When they put medication in there and check it, if the doctor has not checked it without medication, they have not done their job properly. So they should always put medication in there first and then check it. And the second thing what we want to talk about, what we call glaucoma, that's more dangerous. and we don't see much in that patients. There's once in a while we get patients, especially the patients who are diabetic, that can create a problem. But the problem with the glaucoma is that you should get the testing done. Ophthalmologist, optometrist can check it, right? Now we'll talk about the main thing about the doctors check. When the doctors, your doctors are checking it to get the eye doctor to look at it, they want to see there are no damage back there, tissues start to become diseased from the diabetes. And on the left side you can see, and the right, what's behind the eye that can lead to poor vision and even blindness. With that we see it. If you look at the picture, and there are multicolored things in there, there are red dots on there, that we need to look at it. That we always avoid that, but we always check for it. And sometimes I get a patient and they said, how come all of a sudden I get it? My eyesight is fine. Sometimes there are no problems, but later on it can. What I'm looking at now, I want to show it to you. But don't pay too much attention to it. But what we look at it, we did a CT scan of the eye, and it's not like it goes to and directly to the eye. And the other picture on the right hand side, they're showing where there's a problem with the diabetes, and that can be checked. How do you correct it? And then you need to use injections for it. And the presentations we are doing, all the professionals that are here, and we are teaching you, avoid it as much as possible because you can face these problems. I also want to say that most patients I see, when they go to India, they think, they can do whatever, they think they don't have diabetes. When they go on vacation, when they come back here, they want to get it fixed. But even if you go to India, you can still face these problems with diabetes.
So this is all about in this slide. So there are some doctors, they don't have it, but usually you pour down the medication in the eye and then you do the testing. How to detect this condition? So after putting the medication in the eye, then you can check the vision, and then you should regularly see your eye doctor every 3-4 hours. Usually they check there, and then the patient thinks they don't have any problems, and then the answer is right there. Like, it's all good. We don't need to see the. Although I'm diabetic, I don't need to see the eye doctor. But the answer is false. You should see the eye doctor. So because if you are diabetic, you should see the eye doctor, because 90% of the time there is a problem with the eyes. All right. I have the prescription for eyeglasses. I don't need to see that. I am diabetic, but I don't need to see the eye doctor. It's a very common perception. Majority of my patients who come to my practice, later on they get to know that there is a problem with the eyesight, but they don't want to see the eye doctor, don't want to test their eyes, and there is a problem. And then they say I use the eye drops to solve my diabetic issues within my eyes. So if my eyes will be okay with the eye drops, that's not true. It's false. So the brother already mentioned, like, our injections are more thick. Is my diabetic eye examination is covered under BC Medical Service Plan? I knew this question will come up, but the answer is yes. It's true. Some doctors charge money, but I don't know how they handle their business. In my practice, no, I believe it's a medical connection and it should be covered. Okay. So the answer is right here. If I keep good control of my HbA1c levels, I don't need and may not have diabetic retinopathy for at least 20 years. So 7 in 100, if we see according to that, that it shouldn't be any problem with eyes for 20 years, but it doesn't mean that we should see an eye doctor after 20 years. No, it should be seen every year. All right, these are my resources and our professional resources. Thank you.
Thank you so much, Dr. Mohan.